This is CGTN, China Global Television Network.
The Tunisian Health Ministry has released the findings of a study on the impact of the COVID-19 pandemic on the blind and partially impaired citizens. The study has revealed that tens of thousands were forced to stay at home without employment or support. Those who are still working face many challenges in their daily lives. And then Shuashi reports.
Since the outbreak of the pandemic, it takes Khalid Larousi 3 hours to get to work instead of just 1. He wants to respect social distancing and prevention measures. Khalid used to take public transport, which he now avoids.
Blind people are suffering during the pandemic. Using public transport is challenging as one needs to touch the door of the bus, the train, the taxi or anything around to know where to go. It's impossible to disinfect all surfaces. Ordinary people use hand sanitizers and avoid touching infected surfaces, while we cannot.
Khaled is a primary school teacher at a specialized center for blind people. He says his students, as well as the whole educational staff, are suffering during the pandemic.
I teach blind children who need to touch the paper in order to read. Hand movements are necessary in braille reading. Disinfecting the paper and the books usually erases the writing. Then, it's impossible to understand the text.
The IPSAR, Association for the Leisure and Culture of Blind and Visually Impaired People, has launched a national initiative. The project aims to facilitate access to municipal and administrative services for over 21,000 people. According to the Ministry of Social Affairs in Tunisia, over 95% of blind people are unemployed. A general lockdown and the economic impact of the pandemic has increased this figure, while pushing thousands of individuals with disabilities into social isolation and poverty.
Civil society organizations have urged the government to put in place a new health protocol which takes into consideration the needs of the blind and partially impaired citizens. Experts assert that the pandemic has unprecedented health, economic and social consequences on this vulnerable population. Adnan Shawishi, CGTN, Tunis.